This is TTT Live. I'm DK Rosta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Choke City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Thank you for joining us at the Ministry of Health's virtual media conference on the COVID-19 response. Today we have in studio Dr. Roshan Parasram, Chief Medical Officer, and two subject matter experts who are joining us on the conference for the first time. Dr. Rian Extavor, Technical Coordinator, CAFA Caribbean Regulatory System, and Dr. Kadeen Suknanan, a House Officer attached to the Augustus Long Hospital. I'm Candice Alcantara, Manager of Corporate Communication for the Ministry of Health, your moderator this morning. We begin with the clinical update from Dr. Parasram and some additional epidemiological information.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to Dr. Extavor and to Dr. Suknanan, members of the media, members of the viewing and listening public. So we will begin with the clinical update as of Sunday, 21st March 2021. Total number of tested persons so far at both public and private facilities, 104,790. Over the last 24 hours, we would have received 16 new positive cases, taking our total tally up to 7,855. Recovered patients thus far now stand at 7,561. Total active positive cases now at 154. Those in home isolation at 126, and deaths remain at 140. With regards to our hospital patients, we have 12 persons in hospital at this time, no one in step-down facilities, and 314 persons in state quarantine facilities. So with regards to our hospitals, 9 of those individuals are at the Couva Hospital and Multi-Training Facility, 1 of those persons in ICU, and at the Scarborough Regional Hospital at the Fort, we have 3 persons at this time. So our quarantine sites, breaking down in the numbers into different facilities. Cara Suites, we have 19, Cascadia Hotel 33, Chancellor Hotel 10, Bay Halls 2 persons, Capoc Hotel 62, Lorena B 16, which is actually a vessel, the Napa 14, Paria Suites 26, Regent Star 52, Southern Medical 1 person, Tradewinds 21, UE Canada Hall 36, giving us our total. With regards to our, if I could have my first slide to go a little bit into the epidemiological update. So the update, again, this is the epi curve that we are familiar with. It starts on the left, goes all the way to the right. So the active portion for the month of March is the orange bars to the way right of your screen. And we are seeing, what we're seeing in that orange portion represents an upsurge in the number of cases, which began on and about the beginning of March. Comparatively to the blue graphs, which we see in the middle, we see an increase in the number of cases. And what we are seeing is a rolling average of 10.28 over the last 7 days. 70 cases over the last epidemiological week compared to 37 the week before, represents an 89% increase over that period. 34 cases accrued over the weekend alone, and 142 cases for the first 3 weeks of March, versus 149 for all of February. So we see, generally speaking, there's a significant, which started as a small increase early on into this week, last week, and the latter part of the week before, is now slightly going up as we go forward into March. Next slide. So again, just to break down into disaggregation by age and sex, we find, again, similar proportions that we saw throughout the epidemic, roughly equal proportions in males and females. In this case, females a little bit less, 46.8%, 53.2% for males. And we're looking at the age distribution. These are those persons that have been infected. So less than 25 years of age account for 17.4%, 25 to 49 account for 55.1%, 50 to 59, 13.7%, and those 60 plus account for 13.8%. Next slide. So when you look at the deaths, again disaggregated by age, by sex, we see that 25.7% of all the deaths that we had in Trinidad out of the 140 were in females and 74.3% in males, and again that has remained constant throughout the epidemic in Trinidad. Starting again, age groups less than 50, 13.5% of the deaths, 50 to 59, 16.4, 60 to 69, 26.5, and 70 to 79, 27.2. So we see that 60 to 69 and 70 to 79 category accounting for a large proportion of the deaths. And if you remember the last slide, we saw that those persons had a smaller proportion of cases. Again, 80 plus accounting for a very high proportion, 16.4%. Next graph. So again, this graph I would have discussed Monday prior, and what we would have seen on that occasion was clustering in the Caroni area, which we still see to some extent, but we have seen, if you follow the dark orange colors and the lighter orange colors, we see some spilling over now into County Victoria, into St. Patrick, and some orange bits even in St. George Central and St. George East. If you recall, we would have had a picture a little similar to it where we would have had St. George East for quite a long time being the center of the epidemic. Now we have Caroni as the starting point, and it's spilling over. Remembering that persons reside in a particular area, and of course they go to work in different areas. Someone residing in Caroni, for example, can go to work in Port of Spain or any other part of the country, and then of course the people that now are at risk would be people from all parts of Trinidad and Tobago in some instances. So what we're trying to use the graph to remind us is a very small country. Although we have a cluster of cases occurring in 1 or 2 counties at any given time, that can easily spread to the entire country in a very short space of time, because people live and work and actually go for other activities in many areas of the country and can take the virus with them as they move. So reminding business places in particular that persons entering your establishments, making sure that you sanitize properly and that you have your masks on before you enter your place. So a call to the business owners in particular to make sure that persons abide by the public health guidelines when they enter your business places will go a long way to protect yourself, your workers, and the persons entering your establishment. And a call really for all of us to play our role in terms of personal protection. From the health side of it, we have gone to primary, secondary, and tertiary contacts by way of tracing. We continue to be very vigilant from the healthcare worker side of it. We are swabbing most people within that cohort as we defined, and we will try our best to contain the epidemics as they occur in different parts of the country. But we're asking everyone, all citizens, to play your role as well. Remember that the state of spread is listed as community still. We have a chance of, and it is an invisible virus that we are fighting. You can't tell by looking at someone if they are infected. There's spread from asymptomatic persons, which we know. So you have to take the precautions in all circumstances. If you go out of your home and you go into any circumstance where you drop your guard, meaning you take off your mask for any reason, and you have no physical distance, then you put yourself at risk and you are taking a risk. And I think at this point in time, with the numbers going up, we need everyone to play your individual part, wear your mask appropriately, take as little risk as possible. Even if you go to a gathering, try to maintain the 6 feet distance, sanitize as appropriate, and we can all get the numbers back down where we need them to be. Thank you, Ms. Alcantara.
Thank you very much, CMO. And now we go to Dr. Extavo, who will review the regulatory process that is applied to the development of vaccines. And of course, this helps to ensure the safety of vaccines that are used in Trinidad and Tobago.
Thank you, Ms. Alcantara. Good morning, Dr. Roshan Parasram, Dr. Kadeen Suknanan, members of the media, and the listening public. Thank you for today's invitation. And for a brief moment, I would like to introduce you to the processes of approvals of COVID-19 vaccines. Most of these processes apply directly to medicines as well. So I'll just share my slide set, please. Thank you. So we can move on to the next slide. So what you're seeing is an overview of that process. And the collection of scientific information starts from when the product, the vaccine, the protein elements, the components have to be put together in terms of composition. All of this information feeds into what goes into animal studies, the reactions seen in terms of the immune response, and that informs vaccine efficacy in animal studies. We also have information from clinical trials, phases 1, 2, and 3 in humans, that give us information on safety and efficacy. Regulators then take that information and they would be assessing benefit risk based on the quality information, safety, and efficacy. And that quality information expands to the quality of manufacturing, the information systems, the controls put in place, the quality testing that's done for the vaccine at different stages. And regulators also have to take a look at product labeling. So although there may be a regional system that looks at these key information, each country has to ensure that the labeling is appropriate for its health professionals to use the product appropriately. At the point of approval, that's when the vaccine would be approved for importation and registration. But monitoring does not stop there. The information continues to be collected because any changes to quality or safety or efficacy that arise from studies or any new information or any changes in excipients, those have to be also given to the regulators so that they can continue to assess, does the benefit-risk balance change? And that's always the goal. Next slide, please. The World Health Organization recognized that many countries need support in doing this step in terms of assessing medicines, vaccines, and test kits. And they've rolled out their emergency use listing pathway. It wasn't initiated for COVID-19. This pathway was already in place for previous outbreaks like Ebola, because it would help countries to identify quality-assured, safe, and effective medical products. WHO convenes its assessment experts and they engage national regulators from around the world. So they leverage experience and expertise that already exists. Once the product meets the criteria and it's eligible for that review, they would assess the quality, safety, and efficacy data that's provided, just like a national authority would. And they would also take a look at inspection reports, or they would work with other regulators who would conduct inspections and audits of the systems that the manufacturer would have in place. So throughout the life cycle, that product is monitored for safety, efficacy, and its quality. When the listing is issued, the information that any new information that manufacturer gets has to be shared with WHO so that they can continue to reassess the benefit risk and actively monitor adverse events that would occur in different countries, particularly countries that would rely on their listing. Information on how the product is used is also important, because if they pick up programmatic errors, maybe something is not packaged appropriately or it's not clearly labeled to be stored, those are adjustments that will be needed. Next slide. In Trinidad and Tobago, our national authority is the Ministry of Health. And within the Ministry of Health, the Chemistry, Food and Drug Division would be the unit that receives applications. However, for the WHO emergency use listing of COVID-19 vaccines, they would not get a direct application from an importer. However, the process of assessment and review would still apply. There's a drug advisory committee that would convene and take a look at reports from assessors. They would also consider the reports issued by WHO. And in our context, the CARFA CRS also issues its own report that helps our member states to get an idea of the technical bits and pieces within that WHO dossier, and we'd continue to do that. Once the product is approved, the minister issues licenses for importation or procurement, and any incoming vaccine lots must have a lot approval certificate from a lab that tested each lot and said, yes, it meets the quality standard. And once the product is being used, once the vaccine is being deployed, we continue to collect information on quality, safety, and efficacy. Next slide. So safety monitoring is key, and that doesn't just start when it gets into the arms of persons. Safety monitoring actually starts from all the phase trials in humans. And some may not be aware of it, but phase 3 trials didn't stop when approval happens. some phase 3 trials will go for up to 2 years. And that's the information that will give us for if there's missing information that was not apparent at the point of where we got enough information for efficacy and safety, there will be more information coming from the ongoing trials. In addition, the manufacturer has obligations to submit periodic reports to WHO. At the local level, you will be asked to report on any adverse events or side effects you experience, even if it may seem minor. This is because the ministry would need to collate the information, classify what they're seeing, determine if a scientific link exists, and then decide on how to act. That action is based, again, on that benefit-risk balance. So any information that comes either from the manufacturer or from local use that changes that benefit-risk balance, that informs the decisions on how the public needs to be protected. And this may include changes in labeling, restrictions as to who can use it or how it's used, how it's stored, and in whom we will administer the vaccine. Next slide. The Caribbean Public Health Agency has a unit called the CRS, or the Caribbean Regulatory System. And this unit was set up to assist member states with pharmaceutical regulation, particularly in the areas of approvals for market use and importation, as well as safety monitoring. So within the CRS, we support CARPHA's work by giving information on vaccine approvals, efficacy information, safety information, and we support their public campaigns to encourage persons to learn more about the vaccine and feel assured in their decision making. Next slide. So this is an overview as to how we help with access. And at the start, the Caribbean Regulatory System, we've implemented a review process where we can take a look at what WHO also looked at. So they share their dossiers with us. We look at the scientific information, any responses they would have gotten from manufacturers, the conditions of labeling, and that informs our recommendations to member states. And all of the member states' CMOs have access to the summaries from the Caribbean Regulatory System. In addition, where we get questions about vaccine safety or vaccine use that CARPHA can answer within its remit, we would issue information accordingly. And we continue to work with different networks like the Pan American Health Organization, the World Health Organization, and the regional law enforcement groups, because one of the efforts we'll be working with CARICOM Impacts relates to ensuring our law enforcement can detect and respond to any falsified COVID-19 products they find. Next slide. This is a view of the other arm of what CRS does. It's called VigiCarib, and it's a network for pharmacovigilance, that is safety monitoring and monitoring of quality. And this network shares information on adverse events or adverse drug reactions that are found in the region among our member states. We also share any events of substandard or falsified or unregistered medical products that we would like our member states to maybe take a look at. And because there are shared pathways for accessing medical products in the region, this is useful in terms of making things a little more efficient and widening our vigilance in the region. Next slide. So I will just wrap up by just pointing you to, it's always about assessing risk and benefit, and it's important that case reports need to be fully investigated so that we don't take the decisions to remove quality products that may help us. And the CARPHA CRS has also provided its own webpage just to give an overview of what we do. So thank you again. That's it.
Thank you very much, Dr. Extavor, for just giving us some additional information about all the steps that are taken to ensure that vaccines that are used are safe. We go now to Dr. Suknanan, who is attached to the Augustus Long Hospital. And Dr. Suknanan is a recipient of the COVID-19 vaccine as one of our frontline healthcare workers. And we go to her for her experience with receiving the vaccine.
Thank you, Ms. Alcantara. Good morning to the all members of the panel, Dr. Parasram, Dr. Extava, and the viewing and listening public, a pleasant good morning. I'm Dr. Kadeen Suknanan, one of the house officers attached to the Augustus Long Hospital, the medical faculty that treats suspected and positive COVID-19 patients throughout the public. I'm here today to share with you my experience after having received the COVID-19 vaccine on February 19th, 2021. I was grateful to be given the opportunity, first of all, to receive this vaccine when it became available to us. And it meant even more to my colleagues and I, since we all work in a COVID-suspected facility, so we are at high risk of exposure to this virus. So it was important for us to take this vaccine to protect ourselves from the virus, as well as other patients, and most importantly, our family members, especially in my case, my parents, who are over the age of 65. So prior to receiving this vaccine, the Oxford AstraZeneca COVID-19 vaccine, a screening form was completed. The screening form included details which requested any pre-morbid state that we had, any comorbidities in the past, as well as any allergies that we have, and allergic reaction to any of the vaccines that we have received in the past. Our vitals were taken, and then the COVID-19 vaccine was administered via an intramuscular injection. We were monitored for a period of 30 minutes post-vaccination. This was to ensure that there was no severe adverse reactions to this vaccine. So far, none of my colleagues and I had any adverse reactions. Everyone was normal after the vaccine. Some of the side effects that occurred after the vaccine, which the onset of symptoms, was around 8 to 10 hours post-vaccination. So we had mild, side effects can be classified as mild, moderate, or severe. So in our case, most of us experienced mild symptoms, mild noticeable symptoms, which would be pain at the injection site, fever, and chills. This, again, I reiterate, started 8 to 10 hours post-vaccination and lasted for about 24 to 48 hours. Some of my colleagues experienced moderate symptoms, which would include muscular pain, fatigue, headaches, and severe symptoms would be nausea, vomiting, diarrhea, and a combination of the symptoms mentioned before. None of my colleagues experienced these symptoms, and there were actually some of my colleagues who experienced no symptoms at all. These are normal side effects that can be experienced as with any administration of any vaccines, and it's indicative that the vaccine is actually working, and it's proof that the vaccine is working. Our body, when it receives a vaccine, tends to react and build an immune response to it, which is why we usually have symptoms such as fever, chills, which can be relieved with medication and usually last for 24 to 48 hours. After that, after 48 hours, my colleagues and I were back to our normal baseline functioning level. Vaccines, I believe, continue to be highly effective in preventing disease. Vaccines protect ourselves from contracting any viruses. It protects the public. The more people that are vaccinated, the less likely we are to spreading the virus. Less spread will imply less mutation, and the more people that are vaccinated, the greater the chance we are at flattening the curve and ending this pandemic. So please do not let rumors and myths prevent you from making an informed decision. Please go out and get vaccinated once it becomes available. My colleagues and I are proof that the vaccine did not cause any serious side effects, and we await the second dose of the COVID-19 vaccine on April 16th. Thank you.
Thank you very much, Dr. Suknanan, for giving us your personal experience and that of your colleagues. It is very important that the public understands what happens after the vaccine is received. We go into the question and answer segment. Media representatives, I think you know this, but it bears repeating. Please indicate your name and the name of the media house that you represent before posing 2 questions at the same time, and please make your questions brief so we can get as many questions in as possible. If you have additional questions, we will come back to you once we have time. And we begin with questions from CNC3 Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is to the Chief Medical Officer. Given this rise in cases that you said we've been experiencing recently, is the Ministry of Health concerned or anticipating a third phase of infections? And my second question is to Dr. Suknanan. Now, given the different calls that would have been coming as from the opposition and other quarters of the country about not using that WHO approval and using other regulatory body approvals for purchasing vaccines, such as the FDA and even the European medicines, what is the benefit, or what are some of the key differences between using a WHO-approved vaccine versus vaccines which would have been approved by other regulatory bodies? Thank you.
Okay, so what we saw based on the epidemiological curve that I showed is we are seeing an increase in number of cases over, if you simply compare February to March, you're seeing a significant increase. Now what seems to be going into a significant increase. Some countries have been calling their waves phases, phase 1, phase 2, phase 3. We see in European countries they're using the term phase 3 now. At the end of the day, demarcating, because we had maintained community spread after we had gone into phase 2. If you take your minds back to before July, when we had an 80-odd day period where we had no cases, there was a clear distinction between phase 1 and phase 2. You could see there was an end of phase 1 and there was a restart of cases into phase 2. We haven't seen that clear distinction as yet in phase 2, so we can continue to think or call it phase 2 in our context. Irregardless of what you want to call it, it is a significant increase. Again, looking at upwards of 80-something% in terms of number of cases week on week, and it really needs to be viewed by the public and by the Ministry of Health as something of concern at this point in time. And we have seen, even when we saw the beginning of our phase 2, that the number of cases escalated and the doubling time increased very quickly. And we don't want to get back to that early trajectory of August and September. So we really need everyone to play their part. Follow the public health guidelines. They are there to protect yourself, your families, and everyone in the population. Wear your mask appropriately as much as you can. If you have to take it off, and make sure that you maintain social distance for the period that you have it off as best as possible, because once you're in close proximity to someone without a mask, you are putting yourself at risk and the other person as well at some degree of risk. So maintain the public health guidelines, and we try to get, again, some control where we want it to be. I think Dr. Excofor can begin the second question rather than Dr. Suknanan, and then I can put in, if there's something to be added, I'll add at the end.
Thank you. Thank you for your question. What I would, in brief, the WHO's evaluation that's shared with member states includes extensive information. WHO allows regulators in different countries to be able to see the scientific data, and there's a confidentiality agreement that the regulator signs with WHO and that the manufacturer signs to say to WHO, you can share our information with these regulators. That doesn't happen with other approved medicines or vaccines. With the vaccines or medicines approved by other authorities, that confidentiality agreement doesn't exist. So what countries would have access to is limited to the country's assessment report and key information that's shared from the manufacturer. WHO includes in its dossier exchanges between itself and the manufacturer. So if there were queries that the manufacturer had to respond to, that response is included in WHO's report. WHO also provides an assessment, a benefit risk assessment and conclusion. That is not always shared when, depending on the authority that you're relying on, if you go to an external authority. So the additional work of doing the additional details that may be missing with a vaccine that's approved by another trusted regulatory authority, it may be limited to and may reduce the amount of time and minimize the expediency as to when you rely on what WHO provides. So there are advantages. In addition, with the UN-approved medicines and vaccines that WHO approves for, there are additional steps that PAHO helps us with. So those steps are not in place, and the burden of additional verification goes on to the regulator, which may slow access. Thank you.
Thank you very much, Dr. Extevor. And we go to AZP News now, please.
Good morning, Private Harry, azpnews.com. My questions are for the CMO. CMO, there is a letter that is circulating on social media and online that purports to be from a company called SkyQuest out of Hong Kong, in which they are offering Trinidad and Tobago vaccines. Can you tell me how many such requests that we have right now that the ministry is considering? And secondly, out of this letter, they have authorized a local company called Very Medical and Scientific to authorize they authorize on their behalf to act in this country. It is also being alleged that one minister, D.R.S. Singh's relatives, has an interest in this company. Has the ministry found out anything along these lines in terms of a due diligence? And what is the latest and the status of this matter? Thank you.
Okay. All right. I think those questions were dealt with by the Honourable Minister yesterday, together with some press. So I will leave that matter in the hands of the Honourable Minister for him to continue to liaise with the press with regards to those matters that you've raised.
Thank you very much. And we go now to 98.1, please. Are we ready with 98.1? Okay, if there's an issue there, I think we will go to Newsday instead, and we will come back to 98.1. So we'll go to Newsday now, please.
Good morning, everyone. My first question is for the CMO, and I apologize if you already touched on this. There's some interference on my end. You did mention the upsurge that's happening right now. Is this upsurge still isolated to the County Caroni area? I know that the area recorded quite a few cases in the past few weeks. And if that is the case, what has contact tracing revealed as possible reasons for the upsurge in that area? My second question is for Dr. Sukmana. You mentioned a pre-screening process that everyone had to go through before receiving the vaccine. Was anyone, to your knowledge, denied the vaccine because they did not meet the criteria based on this pre-screening? And if not, in a case like that, what would be the criteria for not being able to receive the vaccine? Thank you.
Okay, so your first question, I had spent some time using a slide with showing different counties early on, basically to say that yes, what started as an upsurge in County Caroni has now seen some cases in Victoria, as well as St. Patrick's, St. George Central and St. George East. And just to underscore the point that really and truly we are a small country, the counties are really for geographic mapping. We try to define cases as using the boundaries, and of course they be controlled by different CMOHs. But from a spread of disease perspective, the virus doesn't stay within a county. People move and the virus will move with you. So it moves to any part of Trinidad and Tobago very quickly once we have people infected in Trinidad. It doesn't matter if you come from County Caroni or Victoria. A lot of people live in deep parts of San Fernando and they work in Port of Spain. And very quickly it can spread from one place to the next. So I think for geographic information system reasons and mapping and following the epidemic, we use those sorts of boundaries. But it's a very small country and cases can spread from one part of the island to the other very, very quickly. So really, In terms of the second question, you're talking about the pre-screening that Dr. Suknanan would have spoken to is really just a routine health check. So what we do is you take your blood pressure, you will check your diascan, which is your blood glucose level, and we will also check your pulse. Sometimes we do your temperature as well. So it's a pre-screen to see what your clinical status is like just before you get a vaccine. Of course, if you have extremely high sugar levels, for example, or extremely high blood pressure, or any other condition that warrants medical attention, you'll be given that prior to being given the vaccine on top of it. If you do have fever at that point in time, you won't be given the vaccine at that time. It will be deferred to maybe 1 or 2 weeks later until that particular illness has been resolved. So that's the pre-screening she was speaking of. So people won't be deferred. Is really a clinical pre-screening, just out of an abundance of caution, so that we can monitor you for the 30 minutes thereafter after having the vaccine, and we have a baseline to assess you by. Okay.
Thank you very much. And I think we're ready now with 98.1, so we go there now.
And thank you again, Ms. Alcantara. Stephen Cummings, 98.1 FM. My two questions are for Dr. Parasuram. Dr. Parasuram, as we pass the 1-year mark of COVID-19, the COVID-19 pandemic, and where we are, we are all still learning about the behavior of this new disease. Now, I looked at a new study that investigated the relationship between COVID-19 and skin rashes. A team found a direct association between skin rashes and the positive SARS-CoV-2 test. Now, it was also found that as well that more than 1 in 5 persons with the SARS-CoV-2 infection reported skin changes as the only symptom of infection. Has that been part of our findings here in Trinidad and Tobago, more so in recent times, because we have been talking about an uptick in infection? And the second question, Dr. Parasuram, we continue to note the many serious barriers in supply and access to vaccines. I understand that there is to be a meeting with stakeholders and the World Trade Organization to discuss how barriers to vaccines can be overcome. Are we part of any such dialogue at that level, as far as you know, with the WTO? Thank you.
All right, so to answer your second question first, I'm not aware or I'm not privy to that information with regards to the meeting that you spoke about. Your first question, yes, we have seen some skin manifestations of COVID-19 in Trinidad. You would have heard us, I think, at previous press conferences speaking about COVID toes and COVID fingers, which is a sort of vasculitic lesion that really presents on the with redness on the tips of your fingers and tips of your toes, possibly more predominantly in childhood in some instances. So we have seen some skin manifestations, but they haven't been, it has been as a result of the viral illness. And of course, as you know, the treatment is supportive and has been supportive. So not to say that the skin manifestations would really cause any untowards or cause the demise of any particular patient, but we have noted it in our setting as a clinical manifestation or one of the clinical manifestations of infection with COVID-19.
Thank you very much. We go now to TTT, please.
Hi, good morning. Sonal Lala, TTT News. To the CMO, from all reports, contact tracing, that is, what have we seen so far? What is the majority of people we're seeing? Is it family members? Are we seeing people in the workplaces? What are we seeing in terms of that? And my second question is not a COVID-related question, but it is health-related. We understand that some nurses at the SWRHE are not covered under the insurance to actually ride in the ambulances. Can you say if this is true and whether this is for all RHAs and whether anything can be done to remedy the situation if this is in fact true?
Okay, so your question, I'll have to talk to the chief nursing officer about that particular issue, and we can always relay that information back to you offline. With regards to the contact tracing, as I said, what our contact on Saturday, we would have devoted the entire press conference to really having Dr. Hines and Dr. Sin Bernard as one of the CMO, which is going into detail as to what they would have been finding on the ground. And what we really see is that, as I said, people move, right? So household, when you have a case of COVID, primarily your primary group of contacts are the people that live in your home. So those will be primary contacts, and they will be your main source or main cluster of primary infection. The other people that will be in contact will be people that you work with. So your workplace is also identified in most instances, as well as any particular area you would have visited with groups of people in the past, usually starting 48 hours prior to the onset of your symptoms. And it really requires, and a lot of times we can't remember one, and there are a lot of hidden contacts. And just to bring back that term, really it means that you are in contact with a large number of people. For example, if you go to the supermarket, you have symptoms, there are a lot of people that won't know that you were in contact with them directly. And those are the ones, and we have spoken to the business communities earlier today. Having the public health guidelines really are essential to ensure that we don't have spread to persons to person, from person to person, especially minimizing those hidden contacts. So really, we have cases out of these clusters that have gone into large number of secondary and tertiary contacts at workplaces. We have seen it really at places where people go for congregation, for entertainment, and generally speaking, as I said, once you go to an area where you can't have social distancing and you take your mask down, you're putting yourself and others at risk. So we ask that the guidelines be followed rigidly as the numbers increase, and hopefully, if all of us collectively have that level of responsibility occurring again, which we did in the past, we can see those numbers come down, as they have done in the past many times before.
Thank you very much. And I see we have questions from Express newspaper. 2 brief questions.
Good morning, Kimber Drum from the Express. Thank you. CMO, in terms of the public education program or a public education program, there's just so much surrounding the vaccine issue now and a lot of distracted conversation as to the acquisition, where we are, what are we getting, is the public going to accept it? The public already has pandemic fatigue and then, their own apprehension. So I want to know what is the public education program in a nutshell, and are you satisfied that there is an ongoing drive so that all aspects of the public inoculation drive will be ready when we are ready to launch? And then to ask you if you would share your comfort level as to where we are right now, all these factors. We know that there are delays with the vaccines for various reasons. So given that, where we are, public perception or the conversation, are you comfortable as to where we are with our readiness to launch?
Okay, so launching a vaccine campaign is one thing. We can have all systems ready, meaning you have the health facilities ready, you have the vaccines in stock, you have the needles, the syringes, all the other attributes that you want to have in place. The most important thing, as you said, is really whether people are willing to take it or not. As a policy, the Ministry of Health guarantees that we will be using vaccines that are WHO approved only. And Dr. Exover would have taken the time this morning to go through the rigor of the process for WHO approval before you get an EUA or EUL. And we hope that that will give the population some level of confidence that the vaccines that eventually get into Trinidad and the ones we have used, even for the healthcare workers, the frontline persons, were WHO approved. And therefore, there's a certain level of scrutiny that would have gone on to the regulatory aspect of it, and of course lending itself to the safety and efficacy of the vaccine. But again, really and truly, we just look to the population to look at the regulatory process that has been used for decades, have faith in the regulatory process of WHO and of Trinidad and Tobago's internal processes through the Chemistry, Food and Drug Division, which have been approving vaccines for many decades as well, and we have not seen any adverse reactions, severe adverse reactions coming out of the vaccines that go through that process. So have confidence in the regulatory process. We will get the vaccines, we are able to distribute it, but we need every person that it is offered to accept it. And really, as we go forward, we will build towards herd immunity, of course protecting the vulnerable first, but building towards herd immunity so that we can get back to some degree of normalcy by way of public health measures.
Thank you very much, CMO. And we go now to CL Communication, please.
Good morning, everybody. Natalie Singh, CL Communications. St. Vincent and the Grenadines the Prime Minister there, he expressed concern that he's having some challenges with people accepting or even feeling confident about the vaccinations. I was just wondering what sort of prediction do you have for Trinidad? Would you be seeing that same thing where there is unwillingness? And picking up on Kim's point, what would be done to educate the people that you have to be willing to take this vaccination? And then is drastic COVID-19 preventative action going to be implemented for Caroni and the surrounding districts, given that there is an upsurge? So by this, I mean, are you going to have pit stops in between for temperature checks, this, that, and the other? And then would Trinidad and Tobago be interested in getting vaccinations from Russia when those vaccines are approved? Thank you.
The last bit, I didn't hear the last bit. Yeah.
Sorry,
so
could you just repeat the second, your second question, please?
Last question.
Yeah. Is Trinidad and Tobago interested in getting vaccines from Russia when those vaccines are eventually approved? I think WHO is looking at somewhere in April or May to have those approved. I was just curious as to whether or not we would be interested in buying vaccines from that country.
Right. So just to answer your questions, generally in terms of the public health campaign, we have, of course, national level campaigns. We have campaigns by the individual RHAs, and then even at the county medical officer of health level at the ground. So what has happened throughout the epidemic is when we have seen upsurges in different jurisdictions, for example, when there was an upsurge in St. George East, we would have gone to walkabouts in those particular communities where we would have had distribution of flyers and upscaled our ground level communication. That has started or is starting soon in Caroni and Victoria as well, just because of the increased number of cases in those areas, so we could remind persons of the public health measures they need to take. Really vaccine, we want to assure everyone that the vaccines that we take, as I said before, are WHO approved and will be WHO approved. Whether it is from Russia or any other country that receives WHO approval, we look at the efficacy and safety of it, and once it has that WHO approval, that is our policy as it remains. So whether it is from Russia or another country, we'll be happy to look at prospectively those vaccines for acquisition if we need additional quantities of vaccines if and when that time comes.
Thank you very much. And we go to TV6, please.
Hi, good morning. Renessa Cutting, TV6 News. Today is March 22nd, and I know the Prime Minister had indicated that today is the day that we were supposed to receive the first tranche from COVAX. So I just wanted to find out what is the latest correspondence between this government and the facility on this matter, and also if we could have an update on the other bilateral negotiations that are ongoing, please.
Yeah, so I think there was the Honorable Minister would have said end of March, thereabouts, is our timeline. We haven't received anything stating otherwise as yet, so we hold to that sort of time frame. So let us hope in the coming weeks we shall hear an actual date that we'll be receiving our first tranche out of the COVAX vaccine. The bilateral talks continuing as always. I think there was an indication as a press release that indicated there was a non-disclosure agreement signed with both Sinopharm and Pfizer. Once you have a non-disclosure agreement, you can't go into details in terms of that sort of negotiation, quantities, cost, and that kind of thing. So knowing that the negotiations began all the way in October 1st and continue to progress, the other platform, as you know, that is in the public domain is the African Medical Council, which we had received a saving gram up to today from CARICOM, indicating that platform seems to be continuing, and we hope to get distribution in the near future from possibly the African Medical Council once things go well as well. So the three things, just to reiterate what we have been saying, bilateral is continuing. We have the African Medical Council, which is a CARICOM initiative that continues in terms of negotiation, and of course the COVAX facility, which we hope to get our first tranche in the latter part of March.
Thank you very much. And we have a follow-up question from CNC3 Guardian Media Limited, please.
Hi, morning again, everyone. Okay, CMO, or the Bar Owners Association would have said that on December 3rd, they would have met with Ministry of Health officials, and I believe you might have been one of them that they met with, to seek out what they're calling equal opportunity for business, meaning that they can resume some level of in-house service minus the alcohol, no in-house alcohol, but still allowed to sell food and have it dine in. The same opportunities that restaurants and casinos are having. And they said that you all had no problem with that, and they were a bit optimistic and looking forward to them being allowed that facilitation. So I'm just wondering, what's the latest with that?
Yeah, so I think that matter is really is a legal matter in the sense that people have restaurants and bars license, and some people have bar license alone, right? So it's two categories broadly. Persons who have strictly a bar license, and for the bar sector, the public health regulation basically says that you can do takeout, right? So you open for takeout, walk-in, whatever it may. If you have a restaurant and bar license, as you know, restaurants are allowed to sell in-house dining once there's no alcohol. So that is allowed with the regulation the way it is. So it just depends on what type of license you have as an owner. And of course, if you do have a restaurant and bar license, you can sell in-house food, for example, but without alcohol.
Thank you for that clarification. CMO, AZP News, I think we have an additional question from you.
Good morning, Prior again, AZP News. CMO, AZP News has been told that the chemistry, food, and drug lab is not operational, and therefore any sort of approval that has to be given for vaccine or drugs cannot take place. Can you shed some light on that, if this is the case? Thank you.
Okay, yeah. So I think it's known that the chemistry, food, and drug lab is in the process of being renovated. I don't have a timeline as to when it will be completed as yet, but it is in the process of being renovated. It is something that we have lent on the CARFA network through Jamaica. There's a laboratory there, as well as testing through Kariri. There's nothing in the Food and Drug Act that says that we have to actually test a substance before we approve it. So we rely on WHO's having done their due diligence. WHO will actually visit plants that manufacture these vaccines and do thorough inspections. And it is a principle called reliance that we use, and relying on WHO, which is the highest body for global regulation in terms of vaccines, we feel confident that they will do their due diligence and it will follow. And that's why we have said strictly that we will take vaccines at this point that comes from WHO, EU only. And we don't want to rely, for example, on FDA or EMA alone. All right, but it is not a necessary step for vaccines or drugs in terms of the registration under the Food and Drug Act. But we do have a contingency and have used Kariri and other labs when we needed to do testing, especially for pharmacovigilance in the past.
Thank you very much, CMO. And I don't see any more questions on the board from the media. So we have come to the end of today's media conference. Today we focused quite a bit on epidemiological update, all the things that we need to do. We reminded business owners, please, to remember to enforce some of the guidelines for persons that come into your businesses. That includes both your staff and members of the public who come in to purchase or so items from your establishments. We also looked again at all of the steps that are taken both internationally, regionally, and locally to review vaccines and ensure that the vaccines that are used are safe. And we had Dr. Suknanan with us today. She was a vaccine recipient and she gave her personal experience with receiving the vaccine as a frontline health worker attached to the Augustus Long Hospital. And as we leave, as usual, we remind you to wear your mask every day the right way, and we go to a brief video on vaccine safety.